You may proceed.
Can you state your name for us?
Ikundar Shava.
And what is your profession?
I'm a physician.
Is there some specialty within the practice of medicine that you practice?
Family practice.
And can you describe for us the nature of your work as a family practitioner?
We take care of clients from different age groups, starting from the pediatric age group to the adults.
And what types of conditions do you treat?
We treat chronic illnesses, including problems with blood pressure, diabetes, and acute illnesses.
And what do you mean by acute illnesses?
Clients that might have problems in reference to, say, infections, acute and all chronic. We take care of injuries, acute and all chronic.
Would you describe yourself as a primary care physician?
Yes.
And doctor, would you describe or give us some information as to your educational background?
I'm a family physician or primary care physician. I gave you a copy of the CV.
Okay, you provide us with a copy of that, and if you would take a look at what has been marked as Exhibit 3, and would you identify that for us?
Yes.
And what is Exhibit 3?
That's a copy of the CV for myself.
And where did you start? Starting with college, talking about your educational background, doctor. Where did you go to college at?
My college was in India.
And where do you go from there as far as your pursuit of becoming a medical doctor?
Medical school was in Delhi University in New Delhi, India.
Did you become a licensed physician in India?
Yes, I'm a licensed physician in India and in the U.S. too.
Okay, where were you first licensed?
1979.
And that was in India?
Right.
And when did you come to the United States?
We came to this country in 1979.
And what, if any, process was involved in becoming a licensed physician in the United States?
Took the equivalent graduation boards and did a residency in the U.S.
And when did you, in fact, obtain a license to practice medicine in the United States?
1980, I believe.
And have you practiced continuously as a medical doctor in the United States since 1980?
Yes, sir.
And we are here today at your clinic, is that correct?
Yes.
And where is this located at?
This is located in Portage, Indiana.
And how long have you been at this location?
Since 1989.
You also practice out of any other clinic?
We have a second office in Maryville, Indiana.
And I am reviewing Exhibit C3. I see that you list 2 certifications with the American Board of Family Practice. What does that mean, doctor?
After finishing residency, you take your state exams and your board exams. And there's a recertification process every 7 years. So you get recertified. I'm originally certified by the American Academy of Family Practice in 1988. I retook the certification exam in 1995. So those are the 2 certifications.
Those are board certifications.
Right.
And you also have hospital affiliations?
True, yes.
What hospitals are you affiliated with, doctor?
I'm the medical staff at Methodist Hospitals, and I'm the staff at St. Mary's Medical Center in Hobart. And for a period of time, I was on the staff at Porter Hospital too.
Now, doctor, you may realize this already, that we're here regarding a patient of yours by the name of Mark Divyak. Do you have an independent recollection of Mr. Divyak?
Yes, I do.
And what is your independent recollection of him?
Well, he's a fine gentleman, and we have known him for quite a few years.
When you say quite a few years, can you give me some idea how long he's been a patient of yours?
I think he's been with the practice, I think, if I can look at the records, is that okay? And give you an exact year?
Sure.
He's been with the practice since 1998.
Okay. At some point since 1998, doctor, did you become aware of the fact that Mr. Divyak had been involved in a motor vehicle accident?
Yes.
Do you have any specific recollection regarding that incident and the treatment that you provided for him thereafter?
Yes, I do.
Okay, well, with referring to your records, help and assist you in recalling specifically what the nature of his treatment was, his complaints and those things?
Yes.
Okay, well, doctor, let me present you with what I marked as Exhibit 1 with today's date. You see that, doctor?
Yes, I do.
And starting there with page 1, can you identify what that is?
I think this is an encounter of an office visit from July the 12th, I believe.
Is that the first day that you became aware of the fact that Mr. Divyak had been involved in a motor vehicle accident?
That's true, yes.
When you saw Mr. Divyak on that day, did you in fact take a history from him?
Yes.
And what was related to you in the way of the history?
You mentioned the fact that he was involved in an automobile accident. He was run into by, I presume at this time, the defendant.
Okay, did he present with any complaints at that time?
I think he had 3 things that he complained of at that time: elbow pain, back pain, and neck pain.
And did he indicate to you at that time the onset of those complaints?
Mentioned the fact that this was status post after that automobile accident on 4/16/11.
Okay, now, doctor, in your experience, are those the types of complaints or symptoms that can be caused by a motor vehicle accident?
Yes.
And why do you say that?
These are some of the common types of injuries that you do see, especially the neck and the back pain. Elbow pain, it really depends upon the nature of the injury and the type of injury.
Well, as to the back and the neck, what is it about a motor vehicle accident that can cause those types of complaints?
Most of the time, the injuries, if it's not from direct trauma, it's from a whiplash process, and some things that you see pretty often with automobile accidents.
Well, when you mention whiplash, can you be a little more specific as to what happens to the body in a whiplash scenario so as to cause pain?
Well, the body, when you're sitting in an automobile, obviously the body is in motion, and then when there is a sudden deceleration, some body mechanisms do kick in, especially muscular, to help halt the motion. And some injuries are trauma as related to that.
So the sudden stopping of a body in motion can cause pain.
It can cause the muscles to react, and thereby there can be pain, inflammation, and swelling to go with that.
Did you perform an examination of Mr. Deviak on July 12th of 2011?
Yes.
And what were your pertinent findings upon examination specifically as to those areas that he was complaining of?
In reference to on the exam, he was alert and oriented. In reference to the cervical spine, he had decreased range of motion. He had decreased range of motion with muscular spasm. There were no deformities of the cervical spine. Reflexes in the upper extremities were within normal limits. Left elbow, there was some tenderness in the left elbow. There were no deformities of the left elbow. There was normal range of motion. There was no evidence of any muscular weakness. Lumbosacral spine, spasm in the paraspinal muscles with some decreased range of motion. There were no deformities of the lumbosacral spine. Reflexes were within normal limits. Gait was normal. There was no sensory or motor impairment.
Okay, you mentioned the word spasm. Can you identify or describe what you mean by finding a spasm?
A spasm is when the muscles are tight, inflamed, and very often tender to touch.
And what, if anything else, doctor, did you do in reaching a diagnosis of Mr. Deviak's condition as of July 12, 2011?
After reviewing the history, obtaining the history, reviewing what pieces of information we had, we felt at that time that we did make a diagnosis that he had acute lower back pain, mid-back pain, pain in the cervical spine, and either tendonitis or a sprain of the left elbow.
Now, doctor, do you have an opinion as to the cause of those conditions you just identified as being your diagnosis as of July 12, 2011?
From the information that Mr. Deviak did say and believe in, that this was all related to the automobile accident of 4/16/11.
And what do you prescribe, or what is your course of treatment at that time, doctor?
He was started on an anti-inflammatory medication. He was started on naproxen, 500 milligrams, 1 tablet twice a day.
And what is that medication intended to do?
It does help with the inflammation and swelling, and thereby assisting with the pain too.
So as the inflammation decreases, you would expect the pain to decrease.
Yes.
Anything else you prescribed at that time?
Mr. Deviak had, this was 3 months when we first saw him. Almost 3 months since after the automobile accident. He had been seeing a chiropractor, and we requested for him to maybe obtain records so we could evaluate, what exactly had transpired from the time of the accident till now. Because obviously, the accident had been about 3 months earlier.
Okay, in your experience, doctor, is that an unusual situation that somebody would be reporting elbow pain, back pain, neck pain 3 months after a motor vehicle accident?
No.
You just wanted further information as to what his course had been during that 3 months?
we had no clue what had transpired since after the accident. I mean, we were seeing him in July. Having said that, we wanted to get his records, review the records, see what workup and treatment had been initiated. Apparently, he had mentioned that he had been under the care of this gentleman for a very long time, and some treatments had been initiated, and some diagnostics were also performed by the gentleman. So we needed to and wanted to get the records so we could do due diligence and look at what had transpired in these 3 months.
Are you familiar with the practice of chiropractic medicine?
Yes.
Have you, from time to time, referred patients for chiropractic treatments?
I don't recall at this time.
Okay. Do you believe there was anything unreasonable about Mr. Deviak seeking treatment or care from a chiropractor after his motor vehicle accident in April?
Absolutely not. That's not the point I'm trying to make. For us to get to what exactly was the nature of injury, we just needed to look at those records.
Okay. Did you ever obtain those records?
Yes, we did.
What did you glean from your review of those records?
We kind of did review the records. We did discover that some x-rays were done too, but somehow we could not access the pictures to look at, and we just had the verbal translation as to what the findings were.
You reviewed, you mean the report of the x-ray and not the actual film?
Right, that's right. That's very well put.
Were you ever able to obtain the film?
No.
Now again, back to my question, Doctor, can you talk about the x-rays that come into your knowledge, that those have been done upon receipt of the records from the chiropractor? What else, if anything, was pertinent to your care and treatment of Mr. Deviak from the chiropractic records?
I think the chiropractic records did take a while to come in. If I recall correctly, it was about 3 to 4 weeks. You know, it took about 3 or 4 weeks before we could actually access the records. Off this visit, we felt that we should go ahead and proceed with getting some x-rays done.
So you ordered x-rays as of the July 12, 2011 office visit?
That's right. That's right.
And why is it that you ordered x-rays other than the fact that you couldn't get the films from the prior x-rays? What are you looking for by ordering an x-ray?
For one, very often, x-rays done initially might not illustrate the extent of injury, and number two, just wanted to make sure that there was a board-certified radiologist looking at the film. We were not too sure whose interpretation had been for those previous films, so we really didn't know the source.
Okay.
So we wanted to make sure that we, had the films done right, done again.
You wanted to make sure you had a valid
Right.
and accurate x-ray report.
Absolutely.
But as to the x-ray itself, Doctor, what are you looking for? What conditions are you interested in gaining further knowledge of upon having an x-ray done?
We do x-rays because we're looking to see if there's any trauma. Has the trauma created any structural injury? Has the trauma created is there any fractures? Is there any dislocation? Is there any evidence to indicate subluxation in the area of the neck? In reference to the elbow, I would say most often any subluxation, any dislocation, or any subtle fractures.
Okay, so were those x-rays actually done pursuant to your script?
Yes.
Okay, and was there any structural injury, as you just described to us, identified in any of the x-rays?
I presume we have a copy of those records, and I think I'll be delighted to go over the, significant findings here.
Well, my first question, Doctor, and they are, I will tell you, included in Exhibit 1, the x-ray reports.
Okay.
My question first off is, was there any structural damage identified in the x-rays of any of the body parts that were in fact x-rayed?
We were concerned about the findings in the cervical spine, and we were also concerned about the findings in the lumbosacral spine. Yes.
Okay, well, was there any fracture identified?
No.
Any dislocation?
Not that we could tell from the plain x-ray.
You also mentioned subluxation as something you'd be looking for in an x-ray. Was there any subluxation identified?
Not on the plain plane.
Now, as to those three particular findings, fracture, dislocation, subluxation, if an x-ray is negative as to all three of those particular conditions, Doctor, does that mean that no injury exists?
The answer is you're absolutely right. Plain x-rays are very limited in terms of the information that they do provide.
Okay, so a negative x-ray does not mean that an individual is not injured.
That's true.
So as to the findings of the x-rays that were done after your first visit with Mr. Debiak, you mentioned something about those. Can you elaborate upon that, doctor? As to you mentioned the cervical spine and lumbar spine specifically as having findings upon x-ray.
In the cervical spine, alignment was normal. There was mild disc space narrowing as essentially all levels with some osteophytes in the upper cervical spine. There was no evidence of any acute fracture, but it did seem that he might have multi-level neuroforaminal stenosis bilaterally.
Now, as to those conditions you just identified, doctor, were any of those, in your opinion, caused by the motor vehicle accident?
We couldn't tell that for sure at this time, but we just knew the fact that he was having neck pain, and we had some findings on conditions.
Now, my next question, doctor, is are those conditions necessarily symptomatic?
They might or might not be symptomatic.
So a finding of multi-level neuroforaminal stenosis does not necessarily mean that that individual is experiencing pain in his neck.
True.
Can a motor vehicle accident aggravate or exacerbate that condition?
Yes and no.
Well, can a motor vehicle accident cause that condition, or should I say those conditions you just identified as the finding on X-ray? Can a motor vehicle accident cause those symptoms or those conditions to become symptomatic?
Yes, that's very possible, yes.
And why is that true?
Because very often, because of the mobility of the cervical spine and the trauma, you can have inflammation in the small joints and in the ligaments and the musculature around it that would trigger the symptoms.
Do you have any opinion as to whether or not that happened in Mr. Debiak's situation?
Well, we were concerned about the fact that he was very symptomatic with his neck pain and his lower back pain. Now, the lower back was a little bit of a different story here.
Okay.
We could not explain why he was hurting in the lower back. His x-rays, plain x-rays, didn't reveal very much. So, I mean, yes, he was symptomatic, but we didn't have anything showing up on the plain x-rays.
And again, the fact that nothing is showing up on the plain x-rays of the lumbar spine does not indicate that there was no injured condition. Is that fair to say?
Yes.
Now, do you follow up with Mr. Debiak after that initial visit in July of 2011?
Yes, he did follow up.
When do you see him next?
We did subsequently see him on August 2nd, I believe.
And how was he doing at that time?
His symptoms were essentially similar. They had not changed very much at all.
And since the last time you had seen him in July, essentially his treatment had consisted of taking the medication?
Absolutely, yes.
Do you change your plan at that point in time?
Well, we kind of did another physical exam on him.
Were there any new or different findings?
We did notice that there was a little more of a weakness in the left arm and the elbow, and this time his straight leg was positive at 60 degrees. Those were the two new findings. The rest of the physical examination was essentially unchanged.
Did that change your diagnosis of his condition?
Not as much. The diagnosis as we felt that we needed some more information in reference to the neck and the lower back.
So what did you do in trying to obtain that further information?
We did request that he get an MRI scan done on both the cervical spine and the lumbosacral spine.
And was the MRI done?
Yes.
And what, if any, significant findings were made from the MRI scan?
In the lumbosacral spine, what was of concern was at the L3, L4 space, where there was a mention made that there might be an extraforaminal disc herniation. He did have disc degeneration, almost from L1 to L5, but it was the L3, L4 level, which was a little bit concerning to us.
First of all, doctor, can you tell us or describe for us what is a disc when you're talking about a vertebral column?
Vertebral column is composed of two things, the bony tissue, which are the vertebrae, and the vertebrae articulate with each other with particles, and there is this spinous process that keeps this all together. The spinal cord runs into the vertebrae. Now, to cushion the vertebrae, there is spinal cartilaginous tissue, which is called the disc, and that's what comprises the spinal column. So the spinal cord is in the center. The vertebral bodies and the canal holds the spinal cord, and then the vertebrae articulate, which with each other with the facet joints.
Okay, to your knowledge, is this the first finding of a disc herniation at L3, L4 for Mr. Devier?
This is the first one, first time that there was a mention made that there might be an extraforaminal disc herniation, yes.
Okay, based on the MRI alone, are you able to identify when that herniation, if in fact it did exist, came about?
No, we cannot. You cannot. You cannot come up with a time sequence of things, by looking at an MRI scan.
Would an L3, L4 disc herniation, based on your experience, be symptomatic in an individual?
On occasions, yes, but some are asymptomatic too.
Is a disc herniation, again, another condition that may be asymptomatic but becomes symptomatic upon the trauma from a motor vehicle accident?
Yes and no.
Okay, so it can sometimes it isn't.
Absolutely.
And what is the effect of a disc herniation upon an individual?
Well, if it impinges on the nerve roots, then very often one would experience radicular pain.
Did you see that in this particular condition, in this particular situation?
We have clinically, there was no evidence of any radicular pain.
And after reviewing the findings of the MRI, did that in any way change your diagnosis of Mr. Deviek's condition?
Well, we obviously entertained the possibility of a herniating. We obviously entertained the possibility of a herniated disc and radiculopathy. We still didn't have any findings to go with those, but we felt that we needed to do additional workup and get another opinion.
Okay, what did you do in that regard? Did you in fact seek a second opinion?
Yes, we did.
And what did you do?
I think after the visit of August the 25th, when he came in, and that was the time we discussed the MRI findings with him, his symptoms of back pain and neck pain had not significantly improved. We did feel a second opinion was called for, and we did send him to a spine specialist, Dr. Nanatovich.
Now, before we go any further with that, doctor, you had previously mentioned the fact that an MRI was ordered regarding the cervical spine or neck as well, correct?
Yes.
Were there any significant findings upon MRI of the cervical spine?
Cervical spine was significant for disc degenerative disease. It was significant for spurs. It was significant for osteoarthritis. The thing that bothered us the most was at two levels, C5, C6, and C6, C7. At the C5, C6 level, there was the possibility entertained that there might be some encroachment onto the right C6 nerve root. At the C6, C7 level, there was mention made that there might be some compromise of the nerve root C7, both on the left and the right side.
Now, you couched that in terms of might or could be. Did you do anything to confirm one way or the other what you were just describing for us?
Well, the physical examination is the first thing that we do, and the physical examination did not substantiate any evidence of radiculopathy or nerve root irritation. So that was the first thing that we did. And the second, we felt that it would be wise to get another opinion, and that was another reason why he was referred to the spine specialist.
Now, the findings of the cervical spine MRI, did that in any way change your diagnosis of Mr. Deviek's condition?
None at this time. But we did, obviously, now we were entertaining the possibility too of a herniated disc in the lower back, and we were entertaining the possibility of radiculopathy or radicular pain in the area of the cervical spine.
Just so we're clear, what do you mean by radiculopathy, doctor?
When the nerves originate from the spinal cord, they take their exit through very small openings in the spine. Those are called foraminal openings, and very often, if there is injury, if there's inflammation, if there's irritation, then the nerve roots get irritated, and very often the symptoms change, and it has a very different prognosis. If there is a pinched nerve to go with the herniated disc and or any injury to the foraminal area.
Okay, and just so we're clear on the timeline of this, I think we started out this whole line of questioning talking about our August 2nd, 2011 office visit that Mr. Deviek had with you. Then the MRIs are done. When are the MRIs done?
Date of service is 8/4/2011.
And then when do you see Mr. Deviek after the August 4th, 2011 MRIs are done?
He was seen August 25th, 2011.
So when you've been telling us about your plan of action following the MRIs, that's what you're referring to is the August 25th, 2011 office visit.
Yes.
And that's when you make a referral to Dr. Nanadovich.
Yes.
And did, in fact, Mr. Deviak follow up with Dr. Nanadovich?
Yes.
And are you aware of what, if any, findings Dr. Nanadovich made?
Dr. Nanadovich, I'm trying to see if I can get you the exact date, but I presume the records are here. He was seen by Dr. Nanadovich on September 6, 2011.
Okay, did you receive a report from Dr. Nanadovich?
Yes, we did.
And what were you advised?
We were advised, obviously he did a detailed physical exam, revealed all his medications and past histories. Of significance was the fact that he did a very comprehensive and detailed neurological exam too. And then he did review what we felt was we wanted opinion and help with. Both the x-rays of the cervical spine, the lumbosacral spine, and the MRI scans of the cervical spine and MRI scan of the lumbar spine. He did come up with the diagnosis, the impression that most of what we were looking at was musculoskeletal related, and did not come up with anything significant both in reference to the cervical spine and or the lumbosacral spine.
Is Dr. Nanadovich's impression or conclusion consistent with yours?
The answer is to a large extent yes.
And does Dr. Nanadovich make any recommendations regarding care or treatment of Mr. Deviak?
Actually, he just recommended that he continue with most of what we were doing, which was anti-inflammatory, and we kind of talked to Mark about this too, about physical therapy and conservative management.
Then after that time, referring to the visit that Mr. Deviak had with Dr. Nanadovich, do you see Mr. Deviak again?
Mr. Deviak was subsequently seen in our office on September the 27th.
And how was he doing at that time?
He mentioned the fact that he was feeling much, much better.
And what, if anything, do you prescribe in the way of treatment at that time?
His physical exam was essentially unchanged. He had some trouble with naproxen as an anti-inflammatory, and we kind of worked on that. But we felt at this time that we should stay the course and recommend physical therapy be added to the treatment regimen.
Well, you say that he was feeling better, but you also mentioned that the findings on exam were still pretty much the same.
He still has some decreased range of motion in the area of the neck, some localized tenderness, but no new findings besides with the dorsal lumbar spine. Some minimal tenderness in the paraspinal muscles, some localized tenderness, some decreased range of motion, but those findings were essentially unchanged as of the previous visit, but he was symptomatically much improved.
Okay, now this was more than 5 months after the motor vehicle accident. Is that unusual, doctor, in your experience, that an individual would still be experiencing those symptoms?
Yes, some of these do take time to develop.
And it's not unusual for an individual to have these continuing symptoms?
His symptoms were episodic, that they would kind of come and go. He works in labor, and his employment, the kind of work that he does occasionally would exacerbate his neck and back pain, but then he would have better days too.
So he has this neck and back pain, he continues to work, and that makes it worse from time to time?
It does exacerbate his trouble, no doubt.
Would you have preferred that he stay off work so as to allow his body to recover from these conditions?
You know, when we examined him 3 months after the automobile accident, we didn't seem to feel that there were findings significant enough that he needed to get away from work completely. We did allow him, if he felt comfortable, to continue to work, but we needed to do some diagnostics and figure out what was going on too.
Okay, but he should watch himself at work in light of these conditions he's complained of.
Oh yes, I agree with that, surely.
And as of September 27, 2011, you say that Mr. Deviak is still taking the medication you had prescribed him all along.
Yes.
And that's the anti-inflammatories.
Yes.
So you're still trying to decrease the swelling and as a result decrease the pain.
Yes, and we had recommended that he go back to physical therapy, yes.
Okay, when you say go back to physical therapy, what were you aware of in regards to his prior physical therapy?
Well, in 3 months prior to, he was being seen by the chiropractic services, and part of their treatment included physical therapy.
Okay, so you thought as of September 27, 2011, it would be a good idea for Mr. Deviak to seek out further physical therapy.
I think we all felt that was the right approach to take, yes.
Okay, do you know if in fact he did?
Now, Mark was kind of not too sure, and he could not, and I don't know what happened thereafter. He felt that he wanted to go back to the chiropractor because the chiropractor had been able to help him, but his improvement had not been consistently positive. But he was recommended. If he felt comfortable going back to it. I think the name of the gentleman is, I think it's Accord Chiropractic Services. So he was going to make a decision and either go back to him and or the physical therapy program at St. Mary's Hospital. We gave him both the options.
Well, Dr. Nanavich had recommended therapy.
Yes.
Do you know what, if anything, was done in that regard upon that recommendation?
I think both me and Dr. Nanavich kind of got stuck at that level. Mark needed to make a decision and wanted to make a decision, and we left it up to him to make the decision as to whichever route he was going to be more comfortable.
Did you see Mr. Deviak after that September 27, 2011 visit?
I saw him on November 1st.
And what was reported to you at that time?
Actually, this is what he had mentioned, that on days because he has a physical type of a job occupation, he has some good days and some not so very good days. Obviously, when days he's very physically engaged at work, then his symptoms are worse than on the other days that he's not.
Well, as of November 1st, 2011, Doctor, do you believe that Mr. Deviak was still feeling symptoms associated with a motor vehicle accident?
Well, he was still having findings. I mean, symptoms in reference to the neck, no doubt, and the lower back. And he still had some spasm in the paraspinal muscles, both of the neck and the lower back. Yes, he still was.
Okay, and so the back, the work activities were just complicating or making worse the injury he sustained in the motor vehicle accident.
We believe it contributed to the fact that he continued with the symptoms.
What did you prescribe for him as of November 1st?
We felt at this time that to the anti-inflammatory, adding a muscle relaxant would be something worth attempting. So we started him on Flexeril at that time, which was a muscle relaxant.
So an additional medication is prescribed beyond the anti-inflammatory.
Yes.
But he's still on the anti-inflammatory as of November 1st.
Yes.
Did you see Mr. Deviak after November 1st?
He was subsequently seen on December 1st, 2011.
And is that still in regard to the auto accident?
Yes.
And how was he doing at that time?
His principal complaint at that time was the elbow pain. The elbow had become more troublesome to him, and I think that was part of the reason that brought him back in.
Okay, are you aware of any other treatment he's received for his neck or back at that time?
We assumed that he was going for physical therapy. We were aware of the fact that he was still taking the anti-inflammatory and the muscle relaxant, yes.
So you don't prescribe any treatment for the neck or back at that point, meaning December 1st, 2011, other than the continuing medication?
No.
Is that correct what I said?
Yes, I'm sorry.
And what do you do as follow-up with anything regarding the complaints of the elbow?
We felt that the elbow problem was more related to tendonitis of the left elbow. We had not seen anything on the pain x-ray, but since now we were almost 9 months out and he was still complaining of pain in the elbow, we felt that we would scan the elbow to and tested if he would get an MRI scan done of the left upper extremity.
Was that done?
Yes.
The MRI of the left elbow?
I'm sorry, yes.
Were there any significant findings upon MRI?
No.
Again, does that mean there's no injured condition in the elbow?
No, it doesn't mean that.
Okay, did you see Mr. Deviak at any time after that for any accident-related condition or symptoms?
No, not that I recall.
Okay, now doctor, you talked about your care and treatment of Mr. Deviak. You talked about the referral to Dr. Nanavich, the MRIs, the x-rays. All this treatment, all this care that Mr. Deviak received that we just talked about, is there some event that that treatment is all related to?
The onset of his symptoms were as per his history after the automobile accident.
So it's the auto accident that necessitated all this treatment?
It's the automobile accident that necessitated him seeking medical attention, yes.
I have no further questions for you at this time, doctor. Thank you.
Cross-examination.
Doctor, I have a few questions for you. I am reserving the right to withdraw any of my questions subject to the court's ruling on prior objections and any pending or filed motions in one week. Doctor, we met briefly. My name is Yolanda Cardona, and I represent the defendants in this case, I do have some questions for you. And I'm going to refer you to some of the records that I have provided you with. Now, doctor, in front of you, you have a set of documents that you had from your office. Is that right?
Yes.
Okay. You also have a package that opposing counsel gave you.
Yes.
You also have a packet that I just gave you.
Yes.
Besides all these documents that you have in front of you, do you have any independent recollection of this specific patient, Mark Debiak?
Yes, I do.
You do. What are those independent recollections?
I've known the gentleman since 1998.
Okay.
I believe that was the year. And over a period of time, you get to know people that you care for.
So how many patients do you see, let's say, a year, new patients?
Oh, boy, I don't know. I don't think I've looked up those numbers, but I mean, you just want me to make a guess?
Well, no, I certainly don't want you to guess. I guess what I'm getting at is, you remember specific facts about different patients that you see?
No, not all the time, no.
Okay.
But you know, with some patients and families, you've known them for the last 20 years. You do remember things about people, and including some clinical information too. Yes, I do.
Fair enough. Now, if I can direct you to the August 2nd, 2011 visit, if you want to refer to the packet that opposing counsel gave you.
Sure.
Now, according to this record, you saw him on August 2nd of 2011. Is that right?
Yeah.
Now, on that date, I believe earlier you testified that you asked him to get an MRI of both his lumbar and his cervical spine. Is that right?
I believe yes. Yes.
Yes, okay. And he, in fact, did get those MRIs of both his cervical and his lumbar spine. Is that right?
Yes.
Okay, now, the very first MRI that he got was from South Lake MRI and Diagnostic Center. Is that right?
Yes.
Okay, those MRIs are the ones that show that there might be some disc herniation. Is that correct?
Yes.
Okay, as a result of these MRIs, you then instructed him to get a second set of MRIs, and that was with Dr. Nananovich, or you referred him to Dr. Nananovich.
Yes. But can I just explain a little here?
Absolutely.
Dr. Nananovich reviewed the existing MRI scans from South Lake MRI. He did not get a new set of pictures made. He just reviewed the films.
Okay, so Dr. Nananovich essentially reviewed the prior MRI that was taken of Mark Debiak. Is that right?
Yes.
What were Dr. Nananovich's findings, if I may direct you to the second page of his result under radiologic evaluation?
Just give me a second. A minute.
Sure, take your time.
I thought it was here. Was it not?
I think it's after this. One more. There you go. Oh, never mind. This is the packet that opposing counsel gave me. It's this package.
I think I've seen it here. Here we go.
If you can turn to the second page, is it right, doctor, that under radiologic evaluation, the second sentence says, MRI of the cervical spine demonstrates the patient has some mild degenerative changes noted, with no neural element compression or stenosis noted. Is that right?
That's correct.
The second part of the third sentence in this section here says, MRI of the lumbar spine demonstrates the patient has well-maintained disc height with no step-off deformities noted. The neural element compression noted. No herniated bulging disc noted. Is that right?
Yes.
So based on Dr. Nananovich's reports, there was no herniation in Mark Debiak's lumbar spine. Is that right?
Yes.
There was no herniation in Mark Debiak's cervical spine. Is that right?
Yes.
There was, however, some degenerative changes. Is that right?
Yes.
Can you explain to me, and I know you said it earlier, but if you can just repeat it, I would ask you, what are degenerative changes?
Degenerative changes over a period of time, in some people earlier than others, are the changes that happen to the vertebrae and the disc in the nature that they kind of get wore out.
Okay.
Over a period of time. And some of it might be because of lifestyle, some because of occupation, and some even otherwise.
Would it be accurate if I say that degeneration is not caused by an acute incident like an accident? It's something that happens with what you said, wear and tear. Would that be correct?
Yes.
So So the findings on the MRI show no herniation of neither cervical or lumbar spine. Is that correct?
Yes.
Now, if I may direct you back to the packet that I gave you, this one, if you may, it just might make it easier because I have paginated the pages. As you know, doctor, this accident happened in 2011. On December 30th, 1999, Mr. Debiak presented himself to Porter Health Center. He indicated that he had pain. Is that right? That would be on page 1.
Objection.
Do you want me to repeat the question?
Yes, please.
Sure. Were you aware that on December 30th, 1999, Mr. Debiak presented himself to Porter Health Center and he indicated he had back pain? That's page 1 in your records.
This is Portage Health Center.
Is that your facility?
That's us.
That's you, right. So he presented himself to you, essentially. Is that your signature at the bottom of this record?
Yes.
Okay, so he presented himself to you. He came to see you. What did he complain of that day, doctor?
On December 30th, 1999, as I looked through this, actually, he didn't complain of any back pain unless I'm missing it somewhere.
Sure, if I may direct you to the review of...
I take that back. Yes, he was. He had complained of back pain. Yes, I take that back.
Thank you. Now, were you aware that on January 18, 2011, the second page on your packet, he presented himself to St. Mary Medical Center Emergency Department and was diagnosed with lumbar radiculopathy. Is that right?
Give me a minute.
Sure, absolutely. Let me help you.
Yes.
Doctor, can you explain to the ladies and gentlemen of the jury what is lumbar radiculopathy?
Lumbar radiculopathy is radicular pain stemming from the lower back where there is evidence to indicate there might be a pinched nerve. In this case, possibly from the lumbar spine.
And this was...
Or lower back.
Sorry, I apologize for interrupting you. It is my fault. So, as of December, sorry, I apologize, as of 2000, he was diagnosed as having lumbar radiculopathy.
If I might make a clarification here.
Absolutely.
This was one of the differential diagnoses entertained at that time, but the diagnosis was in no way confirmed. He was treated with an anti-inflammatory and muscle relaxer to follow up with a physician at that time. So yes, that was the provisional diagnosis, but maybe not the final diagnosis.
Am I correct to say, though, that the record reflects that under clinical impression, DX1 says lumbar radiculopathy?
Yes, you're right.
Okay, moving on, doctor. You saw Mark Debiak on February 7, 2003, didn't you, for a checkup?
2003?
They're in order. If you just follow, they should be in order.
I'm sorry, can you repeat the question?
Oh, absolutely. You saw Mark Debiak on February 17, 2003, for a checkup. Is that right?
Yes.
And at this checkup, he complained of back pain. Is that right?
Yes.
Now, were you aware that again on December 1st, 2003, that would be on page 6 of your packet, he presented himself to St. Mary Medical Center complaining of back pain on and off for 2 weeks and denied any trauma. Would that be correct, doctor?
Yes.
Now, the following year, on February 4th, 2004, that would be on page 9 in your packet, Dr. A. Ludas from your office saw Mr. Debiak and assessed him as having chronic low back pain, according to the record. Is that right?
Yes.
Doctor, can you tell the ladies and gentlemen of the jury what the word chronic means?
Ongoing back pain.
And how,
For more than a period of time.
so how long does a person have to feel pain for the pain to be chronic?
Generally, if it's more than 6 months, yes.
And we know that it was chronic because dating back to 1999, Mr. Debiak was complaining of pain. Is that right?
Yes.
Now, Dr. Ludas also noted probably OA in the assessment. Is that right?
Yes.
Doctor, can you tell the ladies and gentlemen of the jury what is OA or what OA is commonly used for?
OA stands for osteoarthritis.
And can you tell us what osteoarthritis is?
Osteoarthritis is the commonest form of arthritis. Some people also call it the aging arthritis or degenerative arthritis.
Does osteoarthritis get better over time or does it get worse over time?
Most often worse than better.
Now, were you aware that on June 21st, 2004, Dr. Ludis from your office at Portage Health Center saw Mr. Debian?
Yes.
Now, on this visit, the review of systems, he noted bilateral elbow pain for years, didn't he?
She did, yes.
I apologize, she did.
That's okay.
Now, if you look at the assessment, she also listed having chronic tennis elbow. Is that right?
Yes.
Can you tell the ladies and gentlemen of the jury what tennis elbow is?
It's essentially because of overuse and some trauma over a period of time to the elbow area where the muscles in the forearm are attached to the epicondyles in the elbow.
Does chronic tennis,
It's inflammation and swelling.
does chronic tennis elbow cause pain? I apologize for interrupting you.
Yes.
It causes pain? So doctor, as far as 2004, when you saw him, June 21st of 2004, Mr. Debiak had been diagnosed so far with chronic low back pain, osteoarthritis, and tennis elbow. Is that right?
Yes.
Now, on April 20th, 2005, that's page 11 in your packet, you saw Mr. Debiak, didn't you?
4/20/05?
That's correct.
Yeah.
At this visit, he informed you that he was concerned about his back. If I may refer you to the chief complaint, he informed you that he was concerned about his back pain, and asked for a referral or a suggestion for back pain. Is that right?
Yes.
Now, that day, under assessment, you wrote that he had cervical radiculopathy. Is that right?
That was one of the diagnoses entertained, yes.
Okay, earlier you explained what I believe lumbar radiculopathy was. Now, can you explain to the ladies and gentlemen of the jury what lumbar radiculopathy is?
Cervical radiculopathy?
Cervical, I apologize.
Cervical radiculopathy is pretty much identical to lumbar radiculopathy. The cervical spine, the nerves, as they exit the spinal cord, come out through the foraminal, and if there is compromise or irritation of the nerve roots, then that is cervical radiculopathy in reference to the neck.
Would it be accurate if I say that cervical radiculopathy could be known as just neck pain? Would that be correct?
Yes and no. No, because very often with cervical radiculopathy, you'll get findings in both the upper extremities. You might have findings in the neck too, but very often you'll have findings in the upper extremities too.
Fair enough. Now, that day, doctor, you also asked him to have an MRI of the cervical spine. Is that right?
Yes.
Okay, well, you know what, doctor? Let me stop for a second, and if you can explain to the ladies and gentlemen of the jury where the cervical spine is. I know that there's the cervical, the thoracic, and the lumbar, but can you just quickly explain to the ladies and gentlemen of the jury where those sections are in the human body?
Cervical spine starts at the base of the skull and extends to the top of the thoracic cage. There are several vertebrae and there are discs that go with the vertebrae. And that's the area of the cervical spine. Does that answer your question?
I was more sort of asking, is the cervical spine like where the skull ends and a little bit down in your shoulders? The thoracic is the mid part of your spine, and the lumbar is the lower part of your spine. Would that be correct?
Yes, yes.
Okay, now doctor, can you tell me what the MRI... Okay, now doctor, can you tell me what the MRI... Did you ever get the results of the MRI of his cervical spine? That would be on page 12 in your packet.
We had done an MRI scan of the thoracic spine, and that basically came back as a negative exam. There was no evidence of any disc herniation, no soft tissue swelling. There was no cord compression, and it was returned as normal. MRI of the cervical spine did reveal arthritic spurs causing mild to moderate compression of the right anterolateral wall of the subarachnoid space, C5 and C6, and the left anterolateral wall of the subarachnoid space, C6, C7, but there was no significant cord compression.
Doctor, you said that the results of the MRI indicated arthritic spurs. Is that what you said?
Yes.
Can you tell us what that is?
It's like calcium deposits over the vertebral bodies, and it can also happen in the particles, and that's a reflection of osteoarthritis.
Now, can arthritic spurs cause changes within the cervical spine?
Yes, yes they can, yes.
Okay, so as far back as 2005, Mr. Deviak was diagnosed or having these arthritic spurs that can potentially cause changes to the cervical spine.
Yes.
You then saw Mr. Deviak on May 5th, 2005. That would be page 15. Is that right?
May 5th, 2005, yes.
Now that day he complained of mid-back pain. Is that right?
Yes.
In your assessment section, you wrote cervical spasm and cervical radiculopathy.
Yes.
So it was a continuous issue for him having his cervical radiculopathy.
Yes.
At that time, that day, you ordered him to have a nerve conduction study. Is that right?
Yes.
Did you receive the report of the neurological consultation?
Yes, we did.
And what did it show, doctor?
There was no evidence to indicate a cervical radiculopathy on the nerve conduction study done as of June 17, 2005.
Now, on June 17, 2005, you received a letter from Professional Neurological. Is that right?
Yes.
Now, within that report, in the narrative part of the report, it indicates that he complained of neck pain that increased with physical activity and by raising his hands above his head. Would that be correct?
Yes.
Now, you saw him again on July 12, 2005. That would be page 18 in your packet. On that visit, your assessment was cervical spasm and OA. Is that right?
Yes.
Earlier, you testified as to what a cervical spasm is, but can you just repeat it for us, please?
It's a muscular spasm involving the first vital muscles of the cervical spine.
Does it cause pain?
Pain? Yes.
Now, at the end of that record, it says that the patient agreed to attend the Health Motivation Center. Is that right?
Yes.
Now, do you know if he actually attended the Health Motivation Center?
Yes.
Okay, now, were you aware that at this Health Motivation Center, he was experiencing pain in the elbow as well?
Yes.
Now, were you aware that on August 24, 2005, he was discharged from the Health Motivation Center, according to the record on page 19?
Yes.
Were you aware that according to that record, he had a total of 7 visits?
Yes.
Now, were you aware that those records indicate that he stopped going? Reason for discharge, no further contact. 2 weeks since last visit. Is that right?
Yes, that's right.
Now, were you aware that he had not met the treatment goals when he stopped going?
I believe that's true.
Now, would you recommend that if a person is in pain, he continue going to physical therapy?
Yes.
Especially if he hasn't met the goals that he was there to begin with to reach. Is that right?
Yes.
Okay, now, were you aware that on November 5th, 2007, page 20 in your packet, he presented himself to a court chiropractic with complaints of right hip sciatic nerve in the hip joint area?
I'm not familiar with this visit.
It's page 20 of your package. So you've never seen this record before?
No, I haven't.
So you were not aware that he presented himself saying that he had right hip sciatic nerve pain?
No, I'm not. I've never seen this part of the record and wasn't aware of his visit.
Were you aware that on November 6, 2007, Mr. Deviak treated with a court chiropractic for low back pain and stiffness in the neck? That's page 22 in your packet.
No, I'm not aware of this.
Were you aware that he went to this to this physical therapy for 10 visits?
No, I have no information in reference to this.
Now, doctor, if I may take you to the day of the accident, April 16th. The last time you saw Mr. Deviak before this accident was in 2005, according to what your records reflect. Would that be correct?
There was a visit as of 8/30/07, and at that time, he was seen in reference to some groin pain. That's the only other visit that I see in between those two.
Now, do you know what his condition was immediately before this accident? The accident happened in 2011?
No, I really didn't see him for a very long time.
So the last time you saw him before this accident was in 2007, and that would make it about 4 years prior. Would that be correct?
Yes, and that was a visit, it was a medical visit, not in reference to musculoskeletal problems. So the last I saw him prior to the automobile accident was 7/12/05, yes.
Now, you first saw Mr. Debiak after the accident on July 12, 2011. You earlier testified. Would that be correct?
Yes.
That's on page 23 if you want to refer to it. Now, 3 months had passed since the accident. Would that be correct?
Yes.
And earlier you testified that you were aware he had previously treated a physical therapy through physical therapy.
You mean before the visit of 7/12?
Well, you first saw him on July 12. Would that be correct on page 23?
Yes.
If you want to look at the page, and I'll refer you to that.
Maybe if you can repeat the question.
Oh, absolutely. On page 23 is a record of July 12, 2011, where Mr. Debiak saw you that day. Is that correct?
Yes.
In this record, there's no mention of him attending chiropractic care or physical therapy care. Is that correct?
There is a mention in the record here that he is seeing a chiropractor.
So the records that you provided me are different from what you have there?
I'm pretty sure it should be here somewhere because you have a copy of everything, but he was being seen by the chiropractor since after the accident. So that's when we requested that we get the records. But he didn't bring any records with him. We asked for the record at the time of the first office visit on 7/12/11. Does that answer the question?
Yes, thank you. Now, doctor, just to be clear, as far as your knowledge of the accident of April 16, 2011, is it a correct statement that you have no personal first-hand knowledge as to the accident?
I don't. Yes, you're right.
The only knowledge that you have of this accident is what the plaintiff has appointed. Is that right?
Yes.
You haven't seen a police report?
No.
Now, do you agree that prior to this accident, Mr. Debiak suffered from chronic pain to his lower back or lumbar spine?
Yes.
He suffered from chronic tennis elbow.
Yes.
He suffered from cervical radiculopathy.
I would kind of rephrase that maybe.
Absolutely.
More of neck pain. We could never confirm the diagnosis of cervical radiculopathy, but neck pain and neck spasm, yes.
So prior to this accident, he suffered from neck pain.
Yes.
Now, doctor, we know that he had complaints of similar things before and after the accident. Before the accident, he complained of low back pain, elbow pain, and cervical pain or neck pain. Would that be correct?
Before the accident, the answer is yes to all three. I haven't seen him since after the accident, so I can't make a comment in reference to anything after the accident because I have not seen him in reference to that problem as yet.
So on July 12, when you saw him in 2011, you didn't see him for back pain, neck pain, and elbow pain?
No, what I'm saying is once after the visit of December, I haven't seen him for anything like that. His last automobile visit was on December 1st, 2011. I haven't seen him after that. Let me clarify.
Okay, sure. I apologize. I do understand what you're saying. What you're saying is that as of 2011, December 2011, you haven't seen him again now.
Yes, you're right.
Or right after the accident, you saw him for the first time on July 12, 2011.
Yes, I did.
And at that time, he was complaining of elbow pain, back pain, and neck pain. Would that be correct?
Yes.
These are similar complaints that he had prior to the accident. Would that be correct?
Yes.
So would you say that there's a possibility that these complaints were not directly related to the accident?
He came in on July the 12th with those three major complaints, and you're absolutely right about that. He has had similar complaints in the past. You're absolutely right about that. But he felt that his symptoms might have been exacerbated because of the automobile accident.
Fair enough. Now, on December 1st, 2011, you ordered him to have an MRI of the elbow. That's on page 46 in your package. Would that be correct?
Yes, I have it here.
And the MRI of the elbow reflected negative findings. Would that be?
Yes.
What does that mean, doctor?
Generally, there is no structural defect, and the anatomical locations of things is normal.
Now, does everyone who claim to have back pain, neck pain, or elbow pain, is it always as a result of a car accident? as a result of a car accident or a car accident?
No.
You agree that there's a whole list of things that can cause potentially back pain, elbow pain, and neck pain independent from any accident.
Yes.
A person's activities, like their work habits, what they do for fun, like maybe any sports.
Yes.
Now, a person like Mr. Deviak, who earlier testified that he has a very physical job. Could it be his job that's causing the pain?
Possibly so.
Now, did you have time to review these records prior to this deposition?
Yes.
Did you have time to meet with Mr. Federico before this deposition?
No.
I have nothing further.
Okay, redirect.
Doctor, I have a few follow-up questions for you.
Yeah, sure.
You talk about the fact that you've been the primary care physician for Mr. Deviak since 1998, is that correct?
Yes, sir.
And you just reviewed some medical records that in 1999 Mr. Deviak came in to see you, and that's, I'm referring to page 1 of Exhibit 2, that he actually came in to see you with a complaint of constipation. Is that correct? Page 1 on Exhibit 2?
Yes.
Okay, you also mentioned back pain at that time.
Yes.
And what other complaints did he have at that time?
I'll have to get a better print to read from. Just give me 1 second. Constipation. He described the color of the stool, and he took Metamucil and some tea, and apparently used some suppositories. He did a few enemas. You want me to go on?
No, well, my question, doctor, is you've reviewed these records in Exhibit 2, and what they show is that you've treated Mr. Deviak for a whole array of medical issues over the years since 1998. Is that correct?
Yes.
And as his primary care physician, when he had a problem, he'd come in to see you.
Yes.
And to this day, to your knowledge, you remain his primary care physician, correct?
Yes.
Now, in reviewing the records in Exhibit 2, I understand that Mr. Deviak came in to see you in July of 2005, correct?
In July of 2005, I'm still not finding it. Just give me a second. July the 12th. Is that what we wanted?
Yes.
July the 12th. Yeah, yes, I see it.
Okay. And between 1998 and 2005, Mr. Deviak would come in to see you for essentially any health problem he had.
Yes, I would think so.
And since 2005, or strike that, between 2005 and 2011, have you seen Mr. Deviak?
I believe I did see him on 8/30/07. It was a one-time office visit, yes.
Okay, and what was the issue at the time of that visit?
He came in with pain in the groin area, and it was a one-time episode. The pain had subsequently subsided, and he also did complain of pain in the coccyx area and to the hip.
And he complained of back pain at that time.
He did point towards the back as being one of the locations for the pain too, yes.
So that was in 2007.
Yes.
Okay, what complaints of pain in his back or neck did Mr. Deviak make to you in 2008, 2009, or 2010?
None.
And were you the doctor he was seeing for those kinds of things prior to 2007, correct?
As far as I know, I think we have been responsible for his medical care.
Well, you just said in 2007 when he had groin pain and coccyx pain and the back pain, or the reference to the back, you were the doctor he came to see.
Yes.
Did he ever see you in 2008 for back pain?
No.
Did he ever see you in 2009 for back pain?
No.
Ever see you in 2010 for back pain?
No.
I have no further questions for you, doctor.
Request.
I just have it for you. Doctor, does the fact that he didn't come in to see you in 08, 09, and 2010 mean that he wasn't having pain?
He wasn't seen by us, and we don't know. I mean, I don't know.
So there's a possibility that he could have been seeing another doctor for all you know.
I wouldn't know one way or another.
Nothing further.
All right. No further questions, all right. Thank you. You may step down. Is that all?
Let it rest, Your Honor.
All right. Ladies and gentlemen, at this time we will break for the day. We'll reconvene tomorrow morning at 9 a.m. How many witnesses does it?
I anticipate 2 witnesses, Your Honor.
Okay, 9 a.m. Once again, let me admonish you, you're not to discuss the case with anyone other than yourselves, and only when you're all present in the jury room. And make sure you leave all your notes and anything related to the case in the jury room.